Okay. To begin our medication administration checkoff, I would ensure that the door to the medication room is closed. We would make sure that all conversation with colleagues is limited to essential information only, that we are practicing the no interruption zone policy of our facility, and that we are not answering any cell phones. Okay, so to go ahead and get started, we have our patient care order form and our MAR, and we're going to be comparing the information on the two pieces of paper. As you can see here, I have my MAR and my order form. All right. We have here name Jaguar J. Jones. Over here on the MAR, name Jaguar J. Jones. Date of birth 8/25/1963. Date of birth 8/25/1963. We see here we have an allergy to penicillin. Over here, an allergy to penicillin. We have a medication order here for heparin, 5,000 units subcutaneously every 12 hours. Over here we have heparin, 5,000 units subcutaneously every 12 hours. So the indication over here on diagnosis, we see that our patient was in a motor vehicle accident with a closed head injury. So we're going to be giving the heparin as an anticoagulant to prevent blood clotting due to his injury. And then for right documentation, we're not there yet. I apologize. Now we have both of these confirmed. We're going to take the patient care order form and set it to the side and just use the MAR for the remainder of our procedure. All right, so now we will begin the first check. I'm going to perform hand hygiene, and we're going to do right patient, Jaguar J. Jones. We're going to do right medication. So it calls for heparin, 5,000 units subcutaneously every 12 hours. So we're going to look over here by our vials, and we're going to select heparin. Awesome. So we have heparin here, and we will compare this to the MAR. Okay, our heparin has been grabbed. Now for right dose, it says 5,000 units subcutaneously every 12 hours. We can see here that the concentration on our vial is 10,000 units per milliliter. Now in order to get to our 5,000 units, we are simply going to cut that in half. So half of 10,000 is 5,000. It's 10,000 units per milliliter. So we will be doing a dose of half a milliliter for our patient to get the 5,000 units that they need. All right, so for our for right route, we are going to do heparin 5,000 units subcutaneously every 12 hours. So subcutaneous, that means we're going to be using a 1 milliliter tuberculin syringe, and this has an included 28 gauge by 1/2 inch needle. Peel it open it up. You can see our syringe here. Okay, so this is a subcutaneous injection. Now we're going to take a clean alcohol swab, and we're going to clean the top of our vial. Throw that away. We'll take our syringe, and then we're going to draw up that medication. So again, that's going to be half a milliliter. All right. We're going to scoop the lid back on, set it down, and then we're going to go ahead and I'll show you that that is at half a milliliter. Now we will go ahead and label this. So we're going to take a piece of tape, and on that tape we're going to write the patient's name, the medication name, and the medication dose. So Jaguar J. Jones, this is heparin, and this is 5,000 units or 0.5 ml. 0.5 ml. You can see we have it labeled. And again, you can see that concentration of the vial compared to our MAR. All right, so now we're going to do again right time. So it says heparin 5,000 units subcutaneously every 12 hours. You can see we have not given that medication in the last 12 hours. Therefore, we're good to go with giving our medication. And then for right indication, we are given heparin as an anticoagulant to prevent blood clots to our patient. And then for right documentation, we have all elements of a legal prescription are included. So that's going to conclude our first check. So now, moving on into our second check, we're just going to confirm everything that we have gathered. So here, right name, Jaguar J. Jones, here on our vial as well. Date of birth was 8/25/1963. We know again that he has that penicillin allergy. Right medication, we have heparin. You can see here our vial is heparin, and we drew up heparin into our syringe. Okay. Now for right dose, 5,000 units of heparin. Our concentration vial is 10,000 units. And then as we can visually examine here, we pulled half a milliliter out of our heparin because a full milliliter is the equivalent of 10,000 units, and we need 5,000 units for our patient. So again, right time every 12 hours. Our patient has not received this medication in the last 12 hours, meaning we're good to go. Also for our medication, earlier we would have checked the expiration date, which is 12/5/2028. So our medication is not expired. We're able to use it. Now, for right indication, again, we're using heparin as an anticoagulant to prevent blood clots in our patient. And then right documentation, all elements of a legal prescription are included. All right, so that is going to conclude everything for our second check. Now we are going to gather the MAR, the syringe, and the vial, and we will move to the patient's room. Now, due to my lack of space, I will just position the camera here, and we'll set the patient down right here and reenact entering the patient's room. So entering the patient's room, as you can clearly see on camera, we have the injection pad, you have the allergy tag here, and we have our name tag visual here. All right, so walking into our patient's room, carrying again our MAR, our syringe, and our vial. Hey, how you doing? Good. What's that name and birthday? We'll get a verbal tell. We will also compare to the name tag and the allergy tag. So we have Jaguar J. Jones. Date of birth is 8/25/1963. 8/25/1963. Penicillin allergy. And is there any allergies I need to be aware of? So we'll get a verbal allergy assess as well. Okay. So now we are going to begin our third check. I'm going to perform hand hygiene. We are going to raise your bed up to a working level, sir. I'm going to lower your side rails, and we're going to do our pre-injection assessment. So for heparin, we're going to be doing a blood pressure test. We're going to check your heart rate, and we're going to check your respiratory rate. Okay? So once we check our required vital signs, we are going to then move into right patient once again. So right patient, we have Jaguar J. Jones. Here you can see we have Jaguar J. Jones, okay? Right medication, I have heparin listed on the MAR. We have a vial of heparin that we have pulled from, as well as heparin in our syringe that we have drawn. All right, for our right dose, we have 5,000 units of heparin. So again, our concentration vial, 10,000 units per milliliter. So we drew up half a milliliter to get 5,000 units for our patient. And then again, here on the MAR, you can see where it says heparin, 5,000 units per milliliter. Or sorry, just 5,000 units, I apologize. right route subcutaneously. So we're going to be giving our subcutaneous injection in the abdominal region for heparin. Now in the abdominal region, we will not go above the costal margins here. We won't go below the pubic region. We will not go on the outside of the anterior superior iliac spines, and we'll avoid 1.5 to 2 inches around the patient's umbilicus, leaving us with a U around the belly button to be able to do our injection. All right, so now we will go into right time. So heparin 5,000 units subcutaneously every 12 hours here on our MAR. You can see we have not given this medication in the last 12 hours. Therefore, we are good to go giving our heparin to our patient. Right indication, we are giving heparin. We are giving you a heparin subcutaneous injection in your abdominal region to help prevent any blood clots, okay? So we're explaining the procedure to our patient as well. Then for right documentation, all elements of a legal prescription are included. So now to give the injection, I am going to put on my glove. I will have performed hand hygiene as well. I'm going to assess the injection site, the integrity of the skin and muscles, make sure there's no bruising or lesions or anything of the sort that we could not put an injection in. I'm going to take a clean alcohol swab, and we are going to clean the injection site really good and allow it to dry as well. We are then going to take my injection, pop the cap off. If we can squeeze up 1 inch of tissue, we're going to do a 45-degree angle. If you can squeeze up 2 inches, you'll do about a 90-degree angle. So we're going to assume here I'm pinching up about 2 inches of tissue, and I'll do it from the side so we can watch. So we'll be going in at a straight 90-degree angle, and you don't want to move slow. You want to go quick because it hurts if you go slow. And then we'll push that medication in, pull the injection out, immediately throw that in the sharps container, and then my sharps container here, as you can see. So we have thrown away our needle into our sharps container. We are going to gently apply pressure with a clean alcohol swab. We're not going to massage it though, just apply some gentle pressure on that injection site. Okay, I am going to remove my gloves properly down towards the reciprocal or the trash can. I'm going to perform hand hygiene. We are going to assist my patient to a comfortable position. I am going to assess my patient for any allergic reaction that they might have received from a medication. I am going to document the medication, the time that I gave it, and how my patient handled it. We're going to lower your bed back down to comfort, and I'm going to lift up your side rail. And then we are going to make sure that we come back later, and we're going to reassess our patient for our patient's response to that injection. Okay.